Needs to be 19 before they actually enter their clinical stage. That is, after they've done all of their class time education, they need to be 19 before they go into a hospital setting.
Class 5 coming in with the ability to get a Class 4 before they start their on-the-job training. Some of those duties are doing event coverage, first aid coverage at large events. We certainly do a lot of transfers for patients from one facility to another or from home to a doctor's appointment. So there's certainly more to the job than just lights and sirens emergency response. Our program is structured to combine classroom theory as well as hands-on practical training. Most schedules outline 3 days of classroom time followed by a minimum 1 day hands-on, applying all the skills you've learned in the classroom to the tools and the equipment that we're using, and monitored by lab facilitators.
Being bilingual, especially in the province of New Brunswick, it is going to be an asset. It doesn't mean it's a necessity. There are still jobs for paramedics out there. Now, we teach at a national level, meaning you don't have to be bilingual for all provinces. So some of our students want to go to Nova Scotia, others want to go on the island. So it is an asset, it is not a requirement.
One of the biggest challenges students face right away coming in is the intensity and the speed that our program moves in. We try to make sure that our training will replicate the speed in which we need to function as paramedics.
It was once thought as being a male-dominated type of job. However, now, I mean, we've had some cohorts that actually have slightly more females. So it does vary, but we're looking at around 50-50.
So our program is accredited by Health Canada, which basically means that upon completion, a diploma from our program does allow a student to travel anywhere within Canada. They can work in any province. Only requirement will be for them to write a jurisprudence exam, which is a standard exam covering specific provincial laws, which is very common for all health disciplines. But because of accreditation, you are not required to do any upgrading or bridging to meet the standards of a primary care paramedic in any other province.
We have the distinction of being one of the first colleges in Canada, if not the only one still, to my knowledge, to actually have an ambulance that we can kind of call our own. So we have that hands-on experience. The length of our program, I think we found a happy medium. Some programs are 10 or 11 months, others are a full 2-year program. We've chosen a 15, meaning we'll take the student right through from the beginning to the end. There's no real summer break or anything, so the material stays fresh. But it's also a good time in that we can put out more paramedics. You know, our country needs more paramedics. So we thought that 15-month was a nice happy medium.